So in this video, we're going to be talking about how Professor Green, one of the leading members of Care for England, so they own a load of care homes, has said that care homes should have been prioritised from the start. And so here he is talking to a load of MPs. Professor Green of Care England said people who were most at risk of dying from COVID-19 should have been prioritised from the beginning. He told MPs that there were still problems with testing and PPE in care homes. So this was written 19th of March. So that's like last week. Yeah, last week. And this video will go out tomorrow. So it'll be about just over a week old. And so Matt Hancock, we'll get to him. We'll get to him talking about unprecedented levels of support. Yeah, it should be unprecedented levels of support, Matt, because they need unprecedented levels of help. This guy. Matt Hancock's an absolute joke. It comes as an industry body has said care homes in England were planning their response to the coronavirus with their hands tied because data about outbreaks in the sector were not published until the end of April, so they had no idea what was going on because the data took so long for them to come out. So this figure here is old, but if you look at it, the deaths in care homes make up a significant amount of the overall deaths within the UK. For the second week running, the review of death certificates by statisticians showed that the number of new deaths in care homes had fallen. So these numbers are obviously outdated. Giving evidence to the Health and Social Care Committee, Professor Green said pandemic planning had been completely inadequate and the government had focused on the NHS while discharging infected patients into care homes. He told MPs that despite promises from ministers, there were still huge issues with testing, with results lost and staff waiting 8 to 10 days to find out they have the coronavirus. Also, the fact that with sick pay being so low in this country, a lot of the people, the workers in the care homes might not want to get tested because they already struggle to live on wages that are extremely low. And that by being forced to stay home on sick pay, they would be getting even less, and it'd be harder for them to support their own households. And that's another issue with like sick pay and pay for care staff. He told MPs that despite promises from ministers, there were huge issues with testing, with results and staff waiting. Yeah, I've covered that bit. And if you look at my Project Cygnus video, politicians already knew that there were problems within the healthcare sector. Answering an urgent question from the House of Commons, Mr. Hancock insisted there were people were sent to care homes when community transmission rates were low. However, a Public Health England survey of England care homes found that agency workers doing shifts in different homes were a source of transmission. So if you've got people working in multiple care homes, then if they catch the coronavirus, they can easily spread it into other care homes. The study, which was carried out over Easter weekend, looked at tests of staff and residents, and the results were passed for Department of Health and Care before the end of the month. So this is the end of March. PHE, Public Health England, said that the results suggested there were high numbers of asymptomatic or pre-symptomatic cases among staff and residents, and the infection may be being imported into the homes by staff. So essentially they're saying that because staff didn't have protective equipment and weren't tested, they could easily have been bringing in the coronavirus into care homes, and it wouldn't be their fault because they didn't know, because some of them would have not shown the symptoms and some of them might have been in the early stages of having symptoms. Professor Green, not the rapper of course, told MPs that there would need to be forensic examination in the future to prevent a crisis in care homes from happening again. We should have been focusing on care homes from the start of this pandemic, he said. A lot of the focus obviously rightfully went to the NHS, as he points out, but at the same time obviously a lot of support would have to go to the NHS as well. What we saw from the start was a focus on the NHS. We had a disruption in supply chains for personal protective equipment, and you've got to imagine if it was bad in the NHS, it would have been way worse in these care homes, getting the right kind of protective equipment. We saw people being discharged from hospital when we didn't have the testing regime set up. So you had people who had been treated for coronavirus being sent back into care homes without the care homes having the facilities to quarantine these people, especially because they're older. They would need a lot more help if they were being pushed into any kind of isolation. And so these care homes, as stated in the Project Cygnus report that the government had for the last 3 or 4 years, stated these issues. And so the government didn't act on Project Cygnus, and they didn't act here. So despite what's being said, there were cases of people who either didn't have a COVID-19 status or were symptomatic who were discharged into care homes. He added that given that care homes are full of people with underlying health conditions, I think we should have looked at focusing on where people are most at risk were, rather than about a particular organisation. So he's very angry at the situation, obviously with the NHS being prioritised over care homes, which I guess in most people's minds, even in my mind, it makes sense. But at the same time, either way, there were really bad consequences, and we can see the consequences that care homes were essentially left to suffer because of the lack of PPE and the fact that people with coronavirus were being discharged into their care homes. So Mr. Hancock has claimed ministers done everything they can to protect care homes. You didn't, because you knew about Project Cygnus, so you didn't. So don't lie, Matt. And then this is the kicker. He goes, there was a protective ring thrown around care homes, right? Matt, if that's your idea of a protective ring, then I fear to think what you think of anything being treated as normal. So like, oh, the NHS is running as normal. Everything's fine here. You're saying you protected care homes when I think it's around like a fifth of deaths from COVID-19 are from care homes. Your protective ring is a load of rubbish, mate. What you did throw on them is a ring of destruction, and that's a Yu-Gi-Oh reference. If anyone didn't get that one, death sentence. She asked Mr. Hancock. Here we go. Liz Kendall got him. She's like, government ministers are being too slow in their response to care home. Yeah, you got him, Liz. You got him, Liz Kendall. Idiot. She asked Mr. Hancock to explain why the guidance to care homes were unlikely infected was not withdrawn until the 12th of March. So that's a good answer. That's a good question. Mr. Hancock said the guidance to care homes was in place until 13th of March. Whilst community transmission was low, and said, well, we don't know how bad community transmission was because the lockdown wasn't in place and mass testing hadn't happened. Mass testing still isn't happening to an extent. So to argue that community transmission was low is farcical because the lockdown didn't happen until weeks after the 13th of March. I think it was about 2 weeks after. So again, Matt's lying. In early March, the government's chief medical professor, Chris Whitty, warned that MPs, it was hardly likely that community transmission of coronavirus in the UK was already happening. So here, Professor Chris Whitty is making the point that I just made, that because this was pre-lockdown, this advice was given, it's very likely that coronavirus is in the system massively. We can see that in the amount of deaths and the amount of cases that we have. On discharging hospital patients to care, Mr. Hancock said it was important to remember that hospitals can be dangerous for people, but the question you've got to ask yourself is, if they're in danger of catching like MRSA in hospitals, or which one's more dangerous, getting MRSA in hospitals to one person, or discharging them to a care home where they don't have the facilities to isolate a person, which could effectively destroy everyone in that care home, kill everyone in the care home, even the staff. Which one is more dangerous, Matt? I think it's the latter, but whatever you want to believe, you believe. And we stood by the principle of discharging people to care homes, saying that it was appropriate and safe in many cases. It wasn't, Matt. It really wasn't. That's why the deaths are so high. Because you discharge people with coronavirus into care homes. You absolute moron. What's important is that the infection control procedures are in place, and that care homes and those infection control procedures were put in place at the start of the crisis have been strengthened. So you're saying they weren't strong enough in the first place if you had to make them stronger. Come on, Matt. Weak source. Here, Matt Hancock lying again, care homes not being prioritised. It's a joke. It's a joke, and I'm going to leave it there. Let me know what you guys think in the comments below. Like, comment, subscribe, and hopefully I'll see you in the next one.